Hyperosmolar hyperglycemic state complications. Blood glucose levels are very high, greater than 600. History of type 2 diabetes, older age. Neurological manifestations: blurry vision, lethargy. Obtundation, decreased LOC, progression to coma, gradual onset of hyperglycemic symptoms as some insulin is produced, hyperventilation, and abdominal pain less common by carb greater than 18 mg/L, normal anion gap, serum osmolality greater than 320 mg per kilogram, negative or small serum ketones. Diabetes insipidus, insufficient production or suppression of ADH. Polydipsia, increased thirst, polyuria, increased urine output, and can lead to dehydration resulting in weight loss. Hypernatremia and high serum osmolality to 195 mol per kilogram, dilute and copious urine to 120 L day, with a low specific gravity 1.005. Dilantin, Phenytoin, anticonvulsant used to treat generalized tonic-clonic seizures, therapeutic range 10-20 mcg/ml. And it takes 312 months for steady state to be reached. Early toxicity signs: horizontal nystagmus and gait unsteadiness, slurred speech, lethargy, confusion, and even coma. Bradyarrhythmias and hypotension are usually seen with Phenytoin. Gingival hyperplasia is common expected side effect of Phenytoin and does not indicate drug toxicity. Occurs more in those less than 23Y though, who are prescribed greater than 500 mf day. Good oral hygiene can limit symptoms. Other acidness, ataxia, decreased alertness. Trisomy 18, a genetic disorder with a short life expectancy a few weeks after birth. It's a chromosome anomaly characterized by severe cardiac defects and multiple musculoskeletal deformities. End-of-life issues should be discussed early after the diagnosis is confirmed. Trisomy 13 PAD-OS syndrome also results in death. No treatment at this time available. Warfarin, anticoagulant. Range 2.3 to 3.5. Warfarin should only be administered after AR has been checked. Can be given if it is less than 3.5 and should be held and HCP contacted if greater than 3.5. Antidote: vitamin K, neutrophils. Normal 1503. Neutropenic precautions: private room, strict hand washing, avoid exposure to people who are sick, avoid all fresh fruits, veggies, and flowers. Ensure all equipment used with the client has been disinfected. Infections in immunosuppressed clients are life-threatening. Avoid IM injections and minimize venipunctures when platelet count is below 50,000, as these can cause prolonged bleeding. Blood lead levels. Common source is lead-based paint found in houses built before 1978. Screenings are recommended at ages 1, 2, and up to 6 if not previously tested. Lead poisoning particularly affects the neurological system. Due to immature development of the brain and nervous system, this is more concerning than the other effects. Can cause neuroimpairment, developmental delays, reading difficulties, visual motor issues, can lead to permanent cognitive impairment, seizures, blindness, or even death. GI bleeding is for iron toxicity, not lead poisoning. Lead poisoning is the most threatening too. The kidneys and neurosystem, developmental delays, cognitive impairment. Seizures, liver injury typically does not occur. Severe liver damage is closely associated with acetaminophen overdose or Ray's syndrome. Asystole. Total absence of ventricular electrical activity, pulseless, apneic, unresponsive. Treatment: CPR, ACLS, epinephrine and or vasopressin, advanced airway use, and any reversible treatment. Vasopressin is a vasopressor that increases vasoconstriction and MAP. SIDS, sudden unexplained death of an infant age 1 year, highest. Occurrence at 24 months, protective factors, supine sleeping position, breastfeeding, pacifier. Use during sleep, up-to-date vaccinations, appropriate clothing, sleep sack, firm sleep surface. Removal of loose items from bed. Risk factors, prone, side sleeping position. Tobacco smoke exposure before, after birth, or any drugs, premature birth, low birth weight. Overheating during sleep, soft sleep surface, bumper pads, toys and loose pillows, blankets. Adalimumab tumor necrosis factor inhibitor. Reduces inflammatory response for rheumatoid arthritis. TNF is a factor in the immune system response that increases inflammation, cause immunosuppression, and increases risk of new infections or reactivation of previous infections, latent TB, hepatitis B virus, other TNF inhibitors, etanercept, infliximab. Opioid intoxication clinical features, depressed mental status. Decreased respirate 12 per minute most notable. Constricted myotic pupils not present in every client. Decreased absent bowel sounds, mild hypotension from histamine release, and bradycardia from CNS. Depression, taking other CNS depressants like alcohol and benzo can worsen rest depression. Flumazenol is a benzo antagonist that can be administered. If there is no response to the naloxone opioid antagonist and ingestion of benzo is suspected, administer naloxone Narcan, a potent narcotic antagonist, to reverse CNS and rest depression. Case manager role, assessing, planning, facilitating, and advocating for client health services to accomplish cost-effective quality client outcomes. This is done through communication and use of available resources. A professional nurse often serves in the case manager role, assesses client needs, decreases fragmentation of care, helps to coordinate care and communication between HCPs, make referrals, ensure quality standards are being met, and arranges for home health or placement after discharge. They do not typically provide direct client care. Medication reconciliation should be done between primary nurse and the HCP. They usually make daily rounds to the nursing depot to review documentation in client charts, but not necessarily visit the client personally. Ziprasidone HCL Geodon. A typical antipsychotic drug that is used for acute bipolar mania, acute psychosis, and agitation. Risk QT prolongation leading to torsade de pointes. Monitor for hypotension, seizures. A baseline ECG and K are usually checked at a minimum. The client should be placed on a cardiac monitor. Alcohol interacts with the drug and increases the potential for an adverse effect from the drug. Isotretinoin accutane decreases the sebum secretion and is prescribed for severe, disfiguring, nodular acne that has been unresponsive to other therapies, including antibiotics. Pregnancy category X drug and is known to cause severe birth defects if taken during pregnancy. Females must have 2 pregnancy tests before taking the med. Also, 2 forms of contraception must have been in place for at least 1 month prior to starting this med before refills can be obtained. Enrollment in a risk management program is required to verify that pregnancy tests are negative and 2 forms of contraception are being used. Blood donation is also discouraged while on therapy and for 1 month after to ensure that pregnant women do not receive any donated blood. Dryness of the eyes, mouth, and skin are common SE. Lubricating eye drops may be needed to wear contacts. Some clients are unable to wear contacts while taking this medication. Good oral hygiene and skin care are needed. Capsules should be swallowed whole with at least 8 ounces water or other fluid. It should not be broken, crushed, or chewed, as contents of open capsules could irritate esophagus. This causes photosensitivity. Use sunscreen routinely. TB drugs, isoniazid, rifampin, ethambutol, pyrazinamide, Isoniazid causes hepatotoxicity and peripheral neuropathy. Rifampin causes hepatotoxicity. Baseline liver function tests should be obtained. Watch for S, massive hepatotoxicity, jaundice, anorexia, ethambutol causes, ocular toxicity, and clients will need frequent eye examination. Rifampin changes color of body fluids, urine. Sweat due to its body-wide distribution, red-orange colors. Tears can turn red, making contact lenses appear discolored. Clients should wear sunglasses instead of soft contact lenses while taking this medication. Women should use non-hormonal birth control methods while taking this drug as it can decrease the effectiveness of oral contraceptives. Don't consume alcohol and drugs that can increase the risk for hepatotoxicity. Acetaminophen during long-term use of this drug. The effectiveness of treatment for active TB is determined by 3 negative sputum cultures and chest X-ray if the entire course of therapy 6-9 months is not completed. Reinfection, spread to others, and development of resistant strains of TB bacteria can result. Increased metabolism of some drugs, oral contraceptives, hypoglycemic, and warfarin can occur as SE. Vitamin K is the antidote for warfarin-related bleeding, aft. 4670. INR 23. Sodium polystyrene sulfonate K-oxalate is a sodium exchange resin administered to reduce elevated serum K levels in clients with chronic kidney disease and hyperkalemia. Warfarin is started about 5 days before a continuous heparin infusion is DC, as it takes this long for warfarin to reach therapeutic levels. Propranolol, beta blocker that inhibits beta-1 heart and beta-2 bronchial receptors. It is used for many indications: essential tremor in addition to BP control. BP decreases secondary to a decrease in HR. Bronchoconstriction may occur due to the effect on the beta receptors. Wheezing in a client taking this drug may indicate bronchoconstriction or bronchospasm. Nurse should assess for any history of asthma or rest problems with this client and notify the HCP. Headache is common occurrence with HTN. Analgesic can be given as needed. It may take several days of treatment for the BP to reduce to a more normal finding. Reduction in HR is expected with beta blockers. Nurse should monitor it for further reduction.